Guys, this is Dr. Jeffrey Cronk. He's also, not only is a great chiropractor, but he's also gone on and get his law degree, and he started the Smart Injury Docs and has several hundred doctors who check in with him weekly or monthly. And really, the best way to describe this is the easiest way to capture your local spinal injury market. The spinal injury market is the largest market in healthcare. Lumbar injuries are the #1 cause of chronic pain and disability, and cervical injuries are the 4th and 6th, which makes spinal injuries the most expensive injuries in the market today. The average yearly cost to medically treat chronic low back pain, according to the leading pain society in America, is $9,000 to $19,000 per year. The American Headache Foundation states that people with chronic headaches are going to spend $8,924 more in medical costs per year than those without this condition. Spinal injuries are extremely expensive long-term. The U.S. spinal injury market is a highly competitive market that at times seems seedy. That's a good way to describe it, Doc. And filled with some unscrupulous practices. This leads some of the best doctors in the market from wanting to participate in it. You're talking to me, that's exactly it. U.S. Softwave doctors have one of the leading technologies that should be applied in every spinal injury case. Yes, thank you. As you provide the patients with a far better odds for full recovery, therefore reducing the future financial exposure that comes with poor cases and poor care. So there is a portion of the spinal injury market that has little or no competition in it, and it can be ethically attract and work with some of the highest level legal, medical, and even insurance professionals. It's not the seedy, high competitive, drop the bill automatically by 50%, or go out and talk to attorneys about how you are growing to increase their claim value market. It is the opposite of that. And I would like to show you how to tap into that. And Dr. Cronk's going to do that today. Opposite of that, which we have been showing doctors how to do this for the last 4 years. In this presentation, Dr. Cronk is going to show you the market where there is no competition, show you how easy it is to tap into that, and it's very lucrative and incredibly purpose-driven. He's going to show you the 4 things that he found that you must do and the resources that he's built to help you. He will also answer any questions that you have. Doctors, this is exciting. Let's take it over. Go ahead, Dr. Cronk.
Okay, so first of all, Matt, thanks for having me come on. Give me an opportunity to talk to your doctors. I know for those of you that don't know me, and let me know that you can see my screen. You see my screen, Matt? Okay, so for those of you that don't know me, I'll introduce myself. Matt gave a very good introduction. I'm almost like, okay, let's just go to the end now that we kind of know. What I want to do is I want to show you the easiest way to capture a local injury market. But the thing that got me really into this is I have been a provider that's been showing diagnostically how to pick up a main injury in the market for a very long time. And I've stayed agnostic to treatment because a lot of the doctors that I work with do a lot of different type things. There's a lot of different techniques, chiropractic techniques. So I've stayed always relatively agnostic. How I got to Dr.DiDuro is I have been doing, we have over 400 doctors in my program, and Softwave kept coming up. As a matter of fact, I was at a seminar, speaking at a seminar, and I thought, I didn't know the difference between Softwave and any of the other products that are out there. So I had a little zapper thing that hit me in the neck. That was about, I don't know, 2 centimeter wand type thing. And I was like, wow, that hurts like hell. But if it's therapeutic, I'll definitely go through it. So I knew nothing about it. As I started to gain information from a number of doctors, it kept coming up as, wow, this is really highly effective. And then I started looking at the science of it, met Dr. DiDuro, looked at the science after what he and I talked and went, okay, this is a phenomenal thing. You have one of the greatest technologies probably out there. And I'm not trying to blow smoke, because I've been doing this for a long time, and too many doctors have said how good this is to me. All right. That being said, he invited me to talk to you who are using this to handle all kinds of chronic conditions, to talk to you about the injury conditions. So for those of you that don't know me, and many won't, I've been a licensed doctor of chiropractic now for 32 years, treated for 17 years. I treated over 5,000 new patients, 175,000 office visits personally. I've developed 2 national spinal ligament injury testing companies. I developed a system that our radiologists use at our current company. I'm a published spinal ligament injury researcher. I developed an online spinal ligament injury training program, which I'm going to talk about tonight, for doctors and for lawyers. I got a law degree in 2013, and I helped co-develop an FDA-approved auto detection spinal instability system, which will mean that what that'll mean is that the process of excessive motion testing, which some of you may or may not know what that is, will scale. We developed a system that every imaging service in the country now could use. Now, that'll be kind of important when I start to get into the injuries itself. So the injury market is really large. As Dr. DiDuro said, 2013, it was a $820 billion area of the healthcare market. It's the largest area of the healthcare market, actually. People can get injured in 4 places. They can get injured at home. They can get injured in public places, such as at sporting events. They can get injured at work. They can get injured in automobile accidents. Doesn't matter where the injuries are, the spine injury is the same. So every 7 seconds, there's a work-related injury. Every 7 seconds, there's an auto-related injury. Every 2 seconds, home-related injury, right? Every day, this stat, I'm just going to throw a couple stats at you. Every day, there's 252,000 medical visits for injuries. Now, about 61% of that is spine-related. So it's an incredibly large, very, very large market. Now, here's where you come in. People who have spinal injuries, by research, have an incredibly low rate of physical recovery. That's probably why in Austria, and don't quote me on it, I'm very not fluent in your technology yet, but that's why when people have spinal cord injuries in Austria, they actually apply this as mandated. Now, as therapies like this come up, it should be mandated on all injuries because these chronicity rates are off the chart. I've always studied these chronicity rates and went, this isn't due to bad patients. This is due to bad doctors who are not finding the solution to what the patient's problem is. So anybody that has an auto injury, for example, do a 10-year study, 86% are chronic with the same symptoms that they had, right? Now, spinal injuries lead to the leading number 1, number 4, and 6 leading cause of chronic pain and disability. You already are doing that with your soft wave. You're already treating neck pain, low back pain, shoulder pain, elbow pain, arm pain, knee pain, all kinds of things, right? But the spine is the most important. It's the most problematic. Now, as Dr. DiDuro said, if I've got an American Pain Society, one of the top pain societies in America, their low back guidelines say if you have chronic low back pain, it's going to estimated cost $9,000 to $19,000 per patient annually to medically manage this thing, not to correct it, to medically manage it. Now, I know you doctors are selling probably cash plans. I bet they're far less than that annually, right? U.S. Pain Foundation says if a person has any form of severe pain, and the spine is the most common, and severe pain would be anything where they have it more than 3 months. They're going to spend an average of $7,700 more. Headache patients are going to spend an average of $8,900 per year more. So these are very, very expensive. Now, the best doctors in the market should be in the injury market. If any of you have ever followed me, that's exactly what I say, because treatment should be the main thing. Treatment results should be the main thing that everything's measured on. The doctors that can treat these and get patients out of these chronic pain conditions are not only a friend of the patient, they're a friend of their attorney, believe it or not, and they're also a friend of the insurance industry itself or the labor or employer industry itself. So that's why I love this. Now, as Dr. DiDuro said it, look, I've been doing this a long time. A lot of times doctors don't want to get in this because they don't want to work with bad attorneys. They don't want to deal with bill reductions. They don't want to compete with unethical practices that could be in the injury market. I say that, you know, this market can be, it's seedy. They don't want to work with questionable cases, questionable patients. They don't want, they're not sure how to document properly or simply. They're not sure how to break the local established network. So everybody thinks, hey, look, these attorneys and the medical doctors, they're already established in these networks, and they don't actually know how to break into those networks if they want to, right? They think they have to have patients already on attached cases to send, and that's this whole market. Well, I'm going to tell you that is the market. They also don't want to be dictated by any attorney what they can or can't do, what imaging studies they should do, or what kind of treatment they should do. And they're worried about depositions a lot of times, or the medical legal process itself, because they don't have a lot of experience with it or think it's kind of a scary thing. It's not. And especially if everything that you're doing is lined up for the greatest good of the patient and you can get results, you can fly in this market. Now, it doesn't mean that you're not going to compete with this. But what I do in a system is show you how to not have to compete with this. This is a commodity business. This is where everybody's the same. Nobody's different. And so everybody's, okay, I'll send it to this group because they'll cut their bill by 50%. Hey, I found a group that'll cut the bill by 30%. Hey, guess what? Unless you cut your bill by 60%, we're sending it over here because they're allowing us to cut it 70%. It's a commodity business. And it's a nasty, like, the worst part of the actual injury market. Now, reasons why you should is the very best doctors should be in this market. Doctors that can get great results should be in this market. Also, it's very lucrative. Now, what you do right now is lucrative, but this is also very lucrative. It's also very purpose-driven. So what I mean by purpose-driven is when you understand the statistics that are in the market today, it's kind of hard not to want to get in there and go, okay, I want to reduce this person's risk of having a long-term lifetime condition. I used to be in my office, and when people would come in with chronic headaches or chronic neck pain or chronic low back pain, I knew I was treating their whole family. I know if I had a woman that had chronic migraine headaches, that her husband was suffering, her kids were suffering, her employer was suffering, her friends were, everybody suffers. So as you improve those conditions, you're improving everybody's life, right? So it's very purpose-driven, and it's kind of cold to not have some sort of desire to want to help these people, even though there is this crazy medical legal environment that you have to operate within. Now, the other cool thing is you're not the brand in the injury market, the clinic is. Now, obviously with a soft wave, that's probably generally true as well. So in other words, it's easier to systemize, it's easier to have associates, it's easier to do those types of things. In the injury space, you're not the brand, the clinic is. So it's very easy to set up associateships. It's very easy to systemize it. It's very purpose-driven, as I said. It's very easy to co-develop your chronic pain services, thereby building your full practice. So the thing that causes acute problems causes chronic problems. So as I'll show you in a bit, I've developed a system where internally you can start to grow your practice for both injury and non-injury patients equally, the same, if you want to. Some people just want to do the injury side of it. I've never been big on that. And the majority of doctors in my program are not injury-only centers. So that's the reason why you'd want to do it. Now, as Dr. DiDuro said, I'm going to keep this very brief. I know you guys are all busy, so I'm pretty much a right to the point guy, but what we developed, I developed a spinal injury doctors program. Now, I'm going to go back just a little bit. I'm going to go back to my background. Okay, when I was doing all of this and developing FDA approved auto detection softwares for spinal instability and doing all of this, I gained a series of, I gained experience that very few people have, because they don't go down this line. There's a lot of things you learn when you're trying to program systems to pick up and auto detect injuries. There's a lot of things you learn when you're trying to explain the injuries, when you're trying to explain to researchers, or you're trying to explain publishing research. And so there's a lot of things that I learned over those 31 years. And really, it wasn't until 1995 is when I really started doing injury work, right? So what we did, all this experience culminated in a program that at first we started out, it was a little program. We just did some webinars and I taught some things, and it culminated into a full-blown program. And that full-blown program is called the Smart Injury Doctors Program. So to kind of give you an idea, there's 4 things that we teach a doctor to do. 1, we teach you how to stand out. And we teach you how to stand out. When I say stand out, I show you a market where you don't have to compete with the rest of the market, a place where there is little or no competition at all. And in showing you that, I show you how to get better patient results. Now, you put better patient results with what I show you with a soft wave, and you got better results on steroids, right? Like right now, I said to Matt before, after I spoke with him, I considered buying a clinic and operating the clinic and running the clinic so I could get back in that game. Right. And I went, oh my God, I would have that. I mean, $80,000 for a unit. Good. Yep. I'll be right on your program. And I still have some, like, I still have been considering it, right? Hey, I could just buy a clinic. I could get back in. So when you actually have that in addition to what I show you, you're like patient results on steroids. And everything I show is guideline compliant. Everything I show is like nothing's opinion. Nothing's my opinion. Everything is what's really there. And it's based on the injury foundation itself. And because of that, once a doctor incorporates it and starts to use it, you'll never not use it. So it's not a scheme. It's not a like quick hey, this is the latest, greatest scheme that's coming down the line. It has nothing to do with that. But what it does have to do is it has to do with the injuries themselves. So I'm going to show you in a program like this, I can't explain a lot, but I am going to show you something of what we use to make you unique. Now, I'm going to show you something here. And there's an aspect of this that I know, because I do a lot, that you've never seen. So the market that we show you is the spinal ligament market. Okay. The attorneys understand just one very small aspect of that ligament structure, which is called the disc, and they really don't even understand that. But they force all doctors to do MRIs. Everybody's got to have an MRI. Whether you need it or not, you're getting an MRI. All right. What we do is I show you the actual spinal ligament injury market, the real spinal ligament injury, and the real spinal ligament injuries are to the support ligaments. Now, this is an angulation. This is hyperangulation. This, by the way, this speed of this animation, if it were in real time, that would have occurred in 1/10 of a second. You wouldn't have even seen it. Okay, so it goes very fast. Now, there's some ligaments that probably none of you even know exist. And those ligaments are the interforaminal ligaments. Now, these and the other ligaments cause chronic pain. Your system goes deep enough for a Campbell soup can. I remember the little bit of training I've got so far. Okay. So you have a system, unlike other systems, that can get deep enough to affect these tissues. These tissues today are just injected. They're injected and injected and injected and injected, and the injection results are not all that favorable. But that's what the pain management specialists know to do. Now, in the future, they should know to incorporate other types of treatment, whether it's the soft wave or it's, the area of injections for stem cells and things like that. But when these interforaminal ligaments are very, very capable of being damaged with excessive motion. So they don't have any place to swell. They swell right into the nerve, as does the capsular ligament, as does the other ligament damage. This is what's called actual translation. Now I'm going to speed this up a little bit. We also, of course, have the ligament damage that comes in the cranial cervical junction that affects the cranial cervical nerves. So what I do is I show you
Wait, I got you. You got to go back to that slide. That is amazing, Doc. I mean, we don't have a ton of docs on this call right now, but you guys, right now, Dr. Cronk is giving you insight that 99% of doctors out there don't even know. So I want to stress this again. This is an important concept, and just share with us again one more time why this is so important. I didn't even know there was those ligaments.
I know. So, and the thing I'm going to tell you, doctors, is, and no doctor should take this the wrong way, but there's a lot of people that think that they know spinal ligament. Oh, it's whiplash, or, hey, yeah, of course, or I do flexion extension studies. I do flexion extension x-rays. Well, that's like, yeah, okay, that big deal. What's on it? So these ligaments let's go, if I showed you another graphic, which I don't have right here right now, but, well, actually I do in another. So I'm gonna scoot down just a little bit. I'm gonna show you a different graphic. Okay, so this is a graphic that we use to explain these injuries. So if you look, this graphic, all these red ligaments are called spinal support ligaments. So I made them red so you could see, or anybody, an attorney or an insurer or anybody could see, there's a hell of a lot more red ones than there are blue ones. Now the blue ones are discs. Okay, so it's very, very common to have severe spinal support ligament damage without disc herniation, but it's very, very rare to have disc herniation without support ligament damage, because part of the support ligament's job is to keep the disc in alignment itself. Now we all know it goes posterolateral because it avoids the posterior longitudinal ligament. What I'm saying is that these other support ligaments are really important. So part of what we've done and the various things, because I have had to spend a lot of time trying to figure out the best way to explain these things, and also to differentiate ourselves in the market from those who kind of think that they know this information. So what I'm saying to you tonight is I'm showing you things that I'm sure you've never seen before. And as we do, part of our FDA compliance is we automate the testing for this. Okay, and the accuracy and the reliability and the repeatability is off the charts. Okay, now it's because, and I don't have time to explain to you all, but when some of you are old enough that you listen to 8-tracks, obviously you would say that's very old technology. Well, the technology that exists and has existed in the market is very old technology. Some of it is really old and really bad, right? So it worked 20 years ago because there wasn't anything else. And so there was an acceptable level of error and inconsistencies. So these are called angular findings. And when you have these support ligaments damaged, they also damage the interforaminal ligaments. And these interforaminal ligaments, along with the other ligaments, when they swell right into the nerve. I mean, if we wanted to go back, if we wanted to go, historically, and I wanted to pull a B.J. Palmer, B.J. Palmer felt that inflammation was probably the most problematic thing. I'm showing it today. This is what it is. This is what we're looking at. This here is.
Can I ask you how deep into the body? And we're definitely going to be able to address this, right, Doc?
Yes.
And we might have to take a 45-degree angle the way those foramen are set up.
Well, you have to remember, a lot of the doctors on the call are also adjusting the spine, and adjustments have an anti-inflammatory aspect on the motion unit itself as well. So I don't think, probably with your protocols, I don't know, because I haven't been to your lab yet.
Yeah.
Yeah.
Well, I was, listen, everyone's always like, can we get to the disc? Can we get to the disc? And I was is like, it's not the disc. I always thought it was the interspinous ligaments and the capsular ligaments, but
Well, it is, but here's the thing: if you're hitting those capsular ligaments, you're hitting the interforaminal ligaments.
okay, good.
Okay, so if you're getting to the capsular ligaments, you're fine. You're hitting in. And again, we kind of
The translation's so important. I mean, the way an injury happens and the way the body moves forward and the head is kind of shifted.
Yes. Yes.
That's ligament. You
Yes.
just I want to do a whole nother talk on how we came up with this and how you really pinpointed, but this is amazing. This is what makes our doctors a different level. Having experts on like Dr. Cronk who are giving you some of his insight. Keep going. This is amazing. I'm loving them.
Okay, so what I do is again, I don't have time to show you everything of what we show you. In this program, the program itself is online training with coaching. But what I do is I show you that market. Now that market is not competing with the disc, dumb it down, spinal injury market. So it's very easy to compete with that market. So I show you a way to, you're basically competing in a market that you don't have any competition. Then the other thing I show you is, hey, you want to build internally. So we developed a whole bunch of internal educational materials for patients. So patients understood what you were doing and what made you unique. Now, the beautiful thing about this with SoftWave is in this area of education. So we said, hey, first you got to know what makes you unique, and you got to know what you got to do clinically. Then you got to know how to build your team, so your team can build people to go out and be your marketers. Part of your team are your patients. Your patients can become your best marketers. And right now you probably have a very good internal program about SoftWave and how SoftWave becomes, something that's makes you unique and stands out in the market. So you have an advantage here. But what I do is I take any injury provider and I say, we have internal marketing materials already produced that explain these to the patient, that will get into an attorney's hands, will get into medical doctors' hands. We have automated email sequences for patients so that they get understanding of this condition and what they can do to help themselves, so they get better results. So part of it is building internally so everybody knows what you're doing and what you're saying and what you're talking about with these injuries. I'll just give you one small example. So if I'm in a consult, I've already done my exam, the paperwork's already filled out, I'm in the consult, I already figured out if there was any gaps in care, gaps in getting the doctor, I figured that out. I've got any pre-existing conditions handled. I've got the incident of the accident, what's the mechanism, I got all the symptoms, everything that I need to know, I have. Now I'm bridging the person over into the exam, and it's very easy for me to say, look, the biggest thing we're going to be looking for is damage to your ligaments. Those are what hold your bones together. Anyone that you know that has any form of chronic low back pain, chronic neck pain, or chronic headaches, which is the first, fourth, and sixth leading cause of chronic pain. So everybody knows people like that. They have this condition. They have a condition or an injury to the ligament. What ligament? I'm talking about the support ligaments. And it usually has gone undetected. We're going to make sure that doesn't happen to you. I just planted a seed. Now, in this portion of the program, I show you how to plant mini seeds. And I show you the materials that we set up so that those seeds are also reinforced with the educational materials. The third thing that you got to do is you got to get some attention in the market. Grant Cardone says money follows attention. Well, referrals follow attention too. Now, you have two things that I'll show you a unique, when Dr. DiDuro says, oh my gosh, we've never seen this. How did you arrive at this? How did I arrive at it? Like the hard way. That's how I arrived at it. Like the super massive, hardest way. Um, now that we're here, there's, I can show it to you and it's like, oh, wow, it'll take you, 10 minutes. But it took a lot to actually get down that simple and really understand this. So what we do in the marketing portion is we show you how to get attention in the market and how to become different in the market. I'm just going to play a short little clip. I could play lots and lots of these, but we don't really have time, but I'll just give you a couple. Going out to attorneys and being able to communicate in a way that kind of bites and indicates, Matt, you on?
Yeah, I'm here.
Matt, you've been in the program for what, maybe 3 months?
Not even, like 60 days.
60 days. Okay.
Maybe
So
9.
how many referrals?
Ooh. 17.
17 referrals. Good.
And from like 6 different attorneys.
Okay, now the backstory of that you need to know is he's a brand new clinic and he's never he shied away from personal injury. He had a very large practice in Florida, moved to Boston, and he completely shied away, never wanted to do personal injury because he didn't like it. He didn't like the documentation. He thought it was seedy, all the reasons that I said before. Today he's up in Boston and he has a much different story to tell. So I'm going to give you another one though, and I'm going to take you into the market that's not seedy. So I do a lot of attorney presentations. This is a comment on an attorney presentation. And I don't think a lot of doctors realize that there are attorneys like this in the market.
Although I want my clients to get a good financial recovery, I also am very focused on them recovering from a medical standpoint, because at the end of the day, their satisfaction with my services, even though I'm not the doctor, their satisfaction with my services is going to depend in large part, probably more so on how their back feels or their neck feels than on the check that they get, especially in a non-catastrophic case.
So obviously that's a point of, and this is what I teach in the program, and this is what I teach about how we make unique, is there's an aspect of the market. You have to understand when you go into an attorney presentation, the attorney is loaded with patients who are not recovering. Now we're going to teach you how to show them why, and it's based on the fact that there's more than a disc injury there, so that not only you're going after their relationships, but you're also going after their referrals and impinging on the fact when an attorney has a patient that hasn't had recovery success, physical recovery success, they cannot get a large enough a settlement in order to get a referral from them. That patient walks out, they got a low settlement, the doctor got all the money, the attorney got all the money, I'm in chronic pain, this was a big ripoff, everybody, the billboard attorney got all of that. All right, so it's much harder to settle claims if the patient is still in pain. It's much easier to settle claims if the patient's not in pain.
Let me ask you, Doc, what is the percentage? And I know we went over some, and you were kind enough to have me on your podcast, but what do you think the percentage of residual pain and suffering goes on with a lot of these accidents?
Well, research says 55% or greater. So if you get into long-term studies, those are off the charts. Then you get into the 75, 80%.
Yeah, and everybody's been paid, and these poor people are just, they can't go back to work, or they can't go back to their main job, and it's just there's no amount of money that you can pay them. They just want their life back.
They want their life back, but the market treats it as if they just want money. Now, I've never personally met a patient that said, look, I want migraine headaches for the rest of my life so I can get 10 grand. Do you know what I mean? So the jadedness of the market out there and the jadedness of some of the mills and some of the things that I've witnessed is that patients are only interested in money. I've never made if you're in that part, you're in that, doctors that would be in that kind of environment are not in my program. Because the cool thing about marketing is marketing attracts what you want, but the other thing it does is it repels what you don't want. So if you want to act like a laundromat or position yourself as a laundromat, you're going to get laundromat people. And I'm not saying anything against laundromats or laundromat people. But if you want high-end dry cleaning people, you don't look or act like a laundromat. And so if you're a high-end dry cleaning establishment, you're going to repel the laundromat people. So marketing helps you to attract what you want, and it helps you to repel what you don't want. And this portion of the market, we show you this portion of the market, and then we have a ton of pre-built materials for you, including an attorney presentation that's pretty much second to none, that goes out and explains the little bit that I just started to show you, but it explains it a little bit more. And then the fourth component that we show you is just general follow-up procedures, simple follow-up procedures that are free, that most people don't even think of, that somebody in your office can spend 15 to 30 minutes in the morning doing, that will get you referral relationships, that will get you contacts, and it's virtually free. Now you can ramp up if you want to, you can spend as much money as you want to. Well, we're going to start to show you the basic things first that they require a little bit of time and they don't require any money. But those will not work unless you have the unique thing that I'm showing you in the first step or the first pillar. That's what makes it work, is because you're understanding the full ramifications of this injury. Hope that makes sense. And then we also do coaching. So I also do coaching. And on the coaching, there's twice a week coaching calls where I'm basically on a Tuesday going, okay, here's the step one. Do you have everything clinically? Do you have any questions clinically? Step two is, hey, you're building this internal referral machine. Do you have any questions on it? Thursdays, we're working on, hey, this is the marketing. Are you having any challenges with the marketing? And following Thursday, we're working on follow-up. And so what happens for a lot of doctors is they only need a little bit at first. They don't need a lot. A lot of doctors we do 3 months worth of coaching. They're on the coaching calls for the first month. And then it's like, they've implemented. They might come back on a call, but they're already understanding it. Because I'm not teaching you anything you don't already know. I'm just adding a little tiny bit in some cases, but I'm aligning the information so that you can fully use it. And it's pretty powerful stuff. So what we normally do, and I'm going to kind of wind down, Matt, because you said about 35 minutes. So I try to just throw some slides together to keep it pretty simple. And doctors, I'm going to tell you, there's this idea that, okay, everybody has to hide the money or hide the fees or anything else. I'm going to tell you our program is $6,000. I'm not going to hide it. We're not embarrassed about it. What we do is really unique. And what we show, when Matt Erba came in and he got 17 new patients, he's probably at a case average around 8 to 10,000. So it's $170,000 worth of services in the first 60 days. Now, that's not everybody. He really did what I said to do and applied it. So typically what we'll do is we'll get a call, and a doctor will call, and we'll just set up a PI performance call. What the PI performance call is just a call where we go over 21 kind of areas where you would be losing opportunity for referrals internally. So what I would say is, if you have interest, call us. I'm going to give our number here in just a second, and we'll do that with you. Now, if your interest is, hey, I just want to look at this program, I just want to know what this program is, we'll do the same. You just call, say, hey, I'd like to jump on with Chrissy or Dr. Cronk, and I'd like to see what this program is. I want to hear a little bit more from Dr. Cronk or what he has to say about it. That's fine. We can do that too. And I'm going to have you take down this cell phone number. And this cell phone number is what you would call, and you would set up that appointment. And we'll show you whatever. I mean, you got lots of testimonials. We have lots of clips from attorneys. I have a podcast called the Smart Injury Doctors Podcast. We have a members only, well, not a members only, we have a members only group once you become a member, and that obviously has access to all of our stuff. And then we also have a free group where we put out a lot of information. One of the things that's really unique about this is I can give you the best information I have. You just won't know how to use it. and it's not hard to use, but if you don't know the full context of it, you'll be able to use one aspect of it, but you're just using one aspect of it. And as soon as the first thing that comes up, that's a counter question, or you don't have the full context of it, so you can't fully appreciate or use it. And so the ROI on what you're using is not nearly as high as it can be when you're really understanding what you're doing with it. And the last thing I'm going to say is that I got excited, and I'll do more with Dr. DiDuro, right? Because Dr. DiDuro and what you do with SoftWave was the first time I got excited. I was a spinal rehabilitation guy, Pedabond guy, all the equipment, did early research with head weights. We were the first ones to do head weighting. Worked with Dennis Wogan, who's a guru in creating spinal scoliosis improvements with non-surgical procedures. So this was the first treatment modality where I went, okay, I'm totally sold. Now haven't had it applied to me yet. So sometimes maybe I'm a little premature, but I had too many people that I know and respect that have brought it to me. So that's why I wanted to really do this, and I'll do more with Dr. DiDuro, is because the combination of what you do and this is the perfect combination. There's not a person in the injury market that shouldn't have both.
And I'll tell you what, I shout out to Gary Harcourt, who connected us. And
Yeah.
He's been a part of your group for the last year. He absolutely loves it. He feels he's the one that brought this together, and it is really a marriage made in heaven. And from the first time I got on a call with you, Doc, you just got me so excited, and because this was a gap we were missing. And I want you guys to understand, 26 years ago, the Spine Journal came out with a supplemental edition, and they basically said that we're missing the boat when it comes to whiplash injuries, motor vehicle injuries, acceleration, deceleration injuries. We didn't have a way to diagnose it, and we didn't have a way to treat these soft tissue injuries. We didn't even know where they were coming. This is like an epiphany. One of the reasons I call there "Let There Be Light" is because when I spoke to Dr. Cronk, it was like, boom. Everything I did, I came from the CVP background. You were more Pedabond, but the translations and the way the head moves and what's a normal cervical spine, and you've just really tapped into an area that has been missing for me. Like, you've answered questions. And again, our doctors, we want to put you into a league of your own, right? You've got that with SoftWave, but we have a saying, you want to be a student of life for the rest of your life, and you always want to be learning. ABL, always be learning. And this gentleman is going to take us, even our profession, to levels we haven't seen in a while. Curtis Martin's been one of your members as well. Curtis has 3 big-time clinics in California. And again, this is the first time when I spoke about personal injury or met you that I didn't feel like I had to take a shower afterwards. Everything about that industry is dirty. And
Yes.
kudos to you for not only going to chiropractic college, but then taking it up a notch and going on to get your law degree. You have a unique knowledge that I'm so grateful you're sharing with us. And I know I'm going to sign up for my clinic. And we have 4 doctors here, 2 devices, and I'm just excited to just have you on our team, Doc. Thank you so much.
Matt, likewise.
In closing, this
Yeah.
is the best way to get in touch with Dr. Cronk and his team. It's 727-312-8624. I know my man Davide's on, and he's staying up late. Thank you, Davide, who's in the UK. Drew, anyone have questions? This is the time. If not, I want you guys to call directly to his office. Dr. Drew Smith, who's in North Carolina. I know you do a lot of personal injury. I actually was thinking of you and my cousin, Dr. DeMacco, to have this. Any questions, sir? And how do you think this can help you?
I had a quick question.
Sure, Dr.
The $6,000, is that like a one-time deal, or is this like a, how does that work?
Well, first 6,000 for the first month, and 6,000 for the second month, and no,
Okay.
100%.
This-
No, it's a one-time.
One-time deal.
It's a one-time deal, and the materials you have for life. So you have, it's lifetime access to those materials. There's no additional fees, or there's no additional things. If in the coaching, if a person wants further coaching, sometimes a person will say, okay, I want more than 6 months, which most doctors do not, but if you wanted to, we charge $199 a month. You can turn that on, turn that off.
Mhm.
My thing in coaching is not to get you to be reliant on me. My thing in coaching is to get you to be self-reliant, so you're not reliant on me at all. I want you to use what I have as a stepping stone, and then I want you 6 months or 12 months later teaching me something that I didn't know, or a method that you found to be even more successful. Do you know what I mean? So my
Yeah.
general thing is not to have you be reliant on us or me. And the thing is that's really cool about it, Dr. Drew, is as you understand it, and this stuff is pretty simple, but it took a long time. You got to remember, there's no training in any chiropractic college in the country on spinal injuries. Now, there's no training in any doctor of PT school, any osteopathic college, or any medical college either. So it's not just chiropractic.
Right.
So it took a long time to get it really simple. And the thing that's cool about simple is simple communicates. So it's very easy to communicate to attorneys or medical doctors or other people. And if there's a skill set that, again, I had to learn the hard way, was that. Because I mean, some of the ways we used to explain this stuff was really, I thought it was brilliant. Nobody understood what the hell I was saying. So how brilliant is that? So part of it is that fact that, once you use it, and I say this a lot, once you know what I'm going to teach you, you will never stop using it, because it's a basis of acute and chronic pain when it comes to the spine.
Amazing. We've got this is from Davide, who's it's probably close to 1 o'clock his time. He
Yeah.
said, this has been awesome. Thank you, Dr. Cronk. He wants to know at some point, do you touch on CPT codes in your course? And I would guess yes.
Yes, but the thing is, I'm not a coding or a billing course. Some of this stuff I'm going to assume that you understand. So in other words, we don't get into all the nitty gritty aspects of, okay, what should you bill for a 5 series of X-ray instead of a 6 series, or instead of a Davis series instead of 5, or if you're adding the A to P open mouth, what do you charge for that? But you have access to 400 doctors that are involved with that. So those types of questions usually get in the group. Hey, what do I bill, or what do I charge, or what CPT code do I use? And then you're getting the latest, greatest of these doctors in the field that are saying, okay, this is what it is. This is what you should use.
I will have to say that in the 2.5 years of running Softwave University, and this is for our small group, Shockwave Business Academy, other than the cardiothoracic surgeon who is using our device during open heart surgery, this is the second best talk we've had. And I'm so grateful that you have taken time out of your evening to share this with our doctors.
Quite a compliment. It would be hard to beat an open heart surgery procedure with this.
And I call him the Elon Musk of the cardiothoracic world.
Yes,
So I've got to
yes.
come up with a good nickname for you. But thank you, Doc. Really a pleasure. We're also would love to invite you to be one of our speakers at one of our in-person events, and I'll give you a couple dates and see if you can make it work. But just an amazing stuff, and really eye-opening, and to see the light, to really notice how to get the best results with your patients. Thank you so much. Any other questions?
Thanks for the opportunity, Matt.
Thank you.
I'll stay for as long as anybody has any questions, and you and I will do more. I mean,
Can't wait.
you and I are
Can't
just
wait.
getting started.
Thank you.